Welcome to Magnolia Medical Minutes, your local source for medical insight direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens with SuperTalk Mississippi Media, and today's special guest is Pediatric Nurse Practitioner Ashley Mize. Thanks for joining us, Ashley.
Thanks for having me.
So today's topic is sick season for children. What type of illness increased this time of the year?
We usually see respiratory illnesses like colds, flu, RSV really kick up this time of year, as well as other viral illnesses like stomach viruses.
So how can I protect my children from these illnesses?
So still the number one way that we can keep ourselves and our kids from getting sick is by washing our hands. In addition to hand washing, basic wellness habits are great too. So things like drinking enough water, offering nutritious meals, and making sure that they're getting good quality sleep.
What should I do when my child gets sick?
Most of these types of illnesses can be managed at home with supportive care. Things like rest, fluids, fever treatment when appropriate for age and the situation, and snuggles.
So how do I know when to bring them into the clinic to be seen?
So there are a few hot ticket items that we worry about as pediatric providers. The first one being fevers in certain situations. Most of the time, a fever is a symptom of an illness and it's going to be just fine. But in a very young baby, especially a baby under the age of 2 months, a fever is an emergency. Or if an older child has a fever and they run a fever for 3 or 5 days and it's just not going away, that would be something we would need to check out in the office. We also, with respiratory season, encourage parents to monitor kids' breathing. They can really get increased work of breathing with some of these sicknesses, and that would look like a child who's breathing hard and fast, sucking in between the ribs or having retractions. Their little nostrils can flare out sometimes when they're really working hard to breathe, and we need to see those guys immediately. The other thing is hydration. Just like we talked about, fluids are important. So if parents notice decreased wet diapers or just decreased urine output, lethargic child, they definitely need to come in as well.
So tell me, what exactly is a walk-in clinic and what should it be used for? What situations?
So every weekday, Hannah Beckham, the other nurse practitioner in the office, and I offer walk-in hours. These visits are from 7:30 to 9 o'clock each morning. However, these visits are brief and they're intended for treating these acute illnesses like we're talking about.
Well, thanks again for your time, Ashley.
Thank you so much.
Be sure to join us again next time on Magnolia Medical Minutes for your local expert medical insight directly from the providers at MRHC in Corinth.